Welcome to another edition of Great Health, Abundant Happiness, and Outrageous Love.
Get in there underneath your hat, Bill.
I know, your beak to beak. This video is about heart health. I'm trying to do your own research on this. We're trying to help somebody that has a potential issue, so we're doing some research, and it's just amazing to me. I wanted to get thoughts out there from everybody else. Amazing what we find when we look out there, right? Because I think everyone knows you need to exercise, not vigorously if you've got heart issues, but stay moving. Get your rest. Yeah, get your rest.
You don't want your body and your blood to just sit there and pool. You definitely want to move, and walking is great.
It's great.
Exercise for everyone of every age. Right?
Yeah. So you want to keep moving. You want to decrease your stress and make sure you're getting your sleep. But we're looking at nutrition specifically. Like, what should you change your diet? We know this, and we've read a lot of studies, and as you guys know, we're into this. But as I look at these sites from doctors, there's nothing about nutrition. Or if you go to the American Heart Association, they're promoting things that we know are not good for a happy, healthy heart. It's just amazing to me.
Right. Well, I think what's important to understand is when you're looking at some of these sites that are, government funded or, put out by the government, they're often funded by the dairy industry, the meat industry, large corporations. And so Jeffrey and I were looking at one of the main sites. We've all looked at that one, especially if you're interested in heart health. And it says to eat dairy products that are not without sugar. And it says to eat lean meats. Now, nowhere does it say that by avoiding those foods and eating a plant-based diet or even plant slant diet will you live longer than if you have a meat-based diet. And that is a fact that you can live, I think it's an average of 3 years longer, the same person having a plant-based diet versus a meat-focused diet. And 3 years is a long time, in the scope of things. I would take an extra 3 years and do whatever it took me. But nowhere do you see that. And I think it's also super important to add, and please, if there's any doctors who listen to us, or people who have doctors as relatives, add in here. But our understanding is that most doctors, including, heart doctors, cardiologists, etc., get about 7 hours of nutritional training in their, 4 to 8 years of medical training. And it doesn't really do justice to food as medicine in any way. And so what you've seen happen here is this whole culture of cardiologists that are just fed up with the system and the fact that they're really trained just to treat with medication or surgeries instead of reverse or cure, right?
Right. And now when you say a whole culture,
there's a lot of doctors.
I don't know what the number is it? Oh, because I thought it was a very small portion.
Oh, it's a small, but it's a culture is what I'm saying.
Gotcha.
There are cardiologists now who have sort of crossed over to this, I don't want to use the word homeopathic, but they have studied in depth the science of how food can become your medicine and reverse diabetes, reverse heart disease. Why are all doctors not giving patients that information? And sometimes you'll hear, well, I'm not going to tell my client that because he or she at 90 years old or 60 years old or 50 or 30 is not going to listen and change their diet. That's not for them to determine. I would, in a heartbeat, change my diet, and that's one of the main reasons. Exactly.
Well, that's why I did.
I have colon cancer in my family, so what I was told is that I have a 40% higher risk. Now, what I've learned through my studies is if I continue to eat in the same manner in which I was raised, which was a meat-forward diet, and I would not even say meat-forward, I would say meat-focused, right? I mean, every meal is focused around the meat. There may or may not have been anything else. Then my chance of getting colon cancer was probably even higher than 40%. And I just wanted to put my seatbelt on and eliminate that completely, and that's why I went plant-based.
Well, it's not genetic, as we know.
Well, it can be.
Yeah, I believe the studies reveal that 5%. Yeah,
right.
so but
not
people
40%.
but people get all caught up and say, "Oh, this is the way my whole family's been, and it's in my genes." It's not genetic.
It's
and
not
you're right.
in your
When I
genes,
say,
it's on your plate.
right, when I say it's not genetic, it's like maybe 5% to your point. I mean, it's like everybody thinks it's genetic. That's why I'm making that statement. But the culture needs to shift. It's forget about curing disease. How about preventing disease? That's what we need to do. So I just wanted to share this because this morning we spent some time online and a bit disgusted with what we see out there and the information. And the average person that doesn't know, that's what they see.
Right.
It's really
That's what they're
really
told.
disheartening.
It is.
So just want to know what you guys thought about that, or if you found the same thing, any ideas. And as Karen said, if you're a doctor or know doctors that are trying to change or trying to reverse this trend that we're on, we'd love to hear from you.
Right, because clearly we have a problem here. Diabetes is higher than it's ever been in the history. Heart disease is one of the top killers.
Obesity,
And
over 50%.
Obesity, come on, something is wrong, and it stems. And even this whole pandemic where so many of the deaths were people that were immunocompromised or overweight. If you're overweight during that time or during this time, you have a much higher chance of being taken out by this. So we need to do something and make sure that food is medicine. It's like the fuel, like you put into a car to make it run beautifully, right?
Right.
And if the tank is full and you insist on sticking something else in there, it's not going to work. It doesn't work that way. If the tank is empty, it doesn't work that way. It's a perfect science, and somewhere along the road, food lost its science efficacy, or I don't even know how to state this, and became a sport.
Well, no, it
should be in the Olympics.
Well, it's the understanding of it. That's what it is, and we just lost our way. That's all.
Lost our way. So if you have information on how to help find the way, please, put that down below. But as far as we're concerned, going plant-based or plant slant is, if you get an extra 3+ years, I'm all for it. Wishing you great health, abundant happiness, and outrageous love from Scottsdale, Arizona.